First community conversation, we're joined by Andrea Merrill, a breast surgeon with Sentara Jefferson Hospital. She's sitting down with her.
Dr. Merrill, thank you so much for coming in today. It's great having you.
Thanks so much for having me on.
You are very welcome. You're here to talk about Breast Cancer Awareness Month, which kicks off tomorrow. So let's talk about Breast Cancer Awareness Month. Why is it important, and what message do you want our community to take away from it?
So breast cancer is the most common cancer in women after skin cancer. 1 in 8 women will get breast cancer in their lifetime, and awareness leads to early detection, which can save lives, and I think that's really important for our community to hear.
Absolutely. And there are quite a few myths and misconceptions around breast cancer. What are some of those?
So I hear a lot and I see a lot on social media these days. Some of them are that mammograms cause breast cancer. That is not true. It is true that mammograms do have some small amount of radiation, but that amount of radiation is very small. It's like taking a cross-country flight. And the benefits of mammograms far outweigh the risks, and they allow us to detect cancers earlier, where we can treat them at earlier stages and avoid more extensive treatments like chemotherapy. Another myth I hear is that doing a breast biopsy actually causes the cancer to spread. That also is not true. There's no evidence to support that, and those biopsies are very important for us because they guide our treatment and they may change your treatment plan.
So that's important to bust those myths.
Yes, for sure.
Yes. And then speaking of mammograms, when should people start thinking about mammograms and breast cancer screening?
That's a great question. There's been a lot of debate in the medical community. I think most of the societies and guidelines are finally on the same page these days, and most of us recommend starting at age 40 and doing yearly mammograms. Now, if you have a family history of breast cancer or other certain risk factors, you may be at higher risk, and we may recommend that you start at an earlier age. And we may even recommend that you add on things like an MRI or ultrasound.
Okay. And then if someone is diagnosed with breast cancer, what does treatment look like today, and how has that changed over the years?
So it's changed a lot. So if you know a family member or a friend who was diagnosed even 5 years ago, your treatment may be very different today. We've developed more personalized breast cancer care because of the great research that we do. And so we're doing a lot less extensive surgeries in the breast, less extensive surgeries in the armpit area with the lymph nodes. Some women are even avoiding radiation and even chemotherapy. So it's a lot more personalized, and we're really trying to minimize a lot of the side effects of our treatment.
That's great. And then what can people do to reduce their risk of developing breast cancer?
That's a great question. I wish I had a magic bullet or a magic pill or supplement. A lot of the old-fashioned advice that you hear for your overall health, like exercise, eating healthy, minimizing alcohol, can help reduce that risk. And then getting your mammograms, doing additional screening if you're high risk, all of those things can minimize your risk. Then it's also important to be aware of your breast. If you notice any changes like a new lump, new redness, new skin changes, bring that to the attention of your doctor and get referred for imaging.
Wonderful. Well, thank you so much, Dr. Merrill, for coming in today. We really appreciated you being here.
Thank you so much for having me on.
You're very